My name is Dr. Patrik Suwak, and I'm an orthopedic spine surgeon practicing in northern Colorado, serving the communities of Fort Collins, Loveland, and Greeley. I'm honored to be joining the Orthopaedic and Spine Center of the Rockies after completing my spine fellowship at the historic Twin Cities Spine Center. I specialize in treating both pediatric and adult spinal conditions, ranging from the cervical spine down to the pelvis. I was born in Czechoslovakia, and my family was fortunate enough to move to the States in my childhood. I grew up on the East Coast, and I completed my undergraduate studies at the University of Pittsburgh. Skiing had always been a big part of my life, and I had always wanted to get into big mountain skiing and explore the Rocky Mountains. So after I completed my studies at the University of Pittsburgh and research there, I decided that I wanted to move west, and I spent a good bit of time skiing at a pretty high level in northern Utah in the Wasatch Mountains. I completed my medical training in Arizona, and I went on to do my 5-year orthopedic surgery residency at Louisiana State University in New Orleans. At LSU, during my final year, I served as chief resident at our Level 1 Trauma Center. After I completed my orthopedic surgery residency, I attended the historic Twin Cities Spine Center in Minneapolis, which is America's first orthopedic spine fellowship, founded back in 1971. And I developed my procedures, including minimally invasive surgery, robotic and navigated surgery, as well as treatment of complex adult and pediatric spinal deformity with open procedures. My favorite part of being a physician is developing personal relationships with each of my patients and using my expertise to help them better understand and treat their spinal conditions. Although common, conditions of the spine can be challenging to diagnose and treat and are certainly a significant source of disability for a lot of patients. Fortunately, a majority of spinal conditions can be treated conservatively, and I focus on working with my non-surgical partners, such as physical therapists and physical medicine and rehabilitation doctors. My goal is to treat my patients with the least invasive means possible. And for those patients where surgery is indicated and appropriate, we have a variety of different surgical options, including minimally invasive surgery, as well as open procedures to help optimize outcome and get people back to doing what they like to do. Being in Colorado offers an active lifestyle, and this has been a great opportunity for me to stay involved in the skiing community. I look forward to exploring some of the backcountry and side access that we have here in the Front Range. I also have a wife and newborn daughter, and spending time with them outside of my practice is definitely a top priority for me. One of my other hobbies growing up was illustration and drawing, and although I didn't really pay a lot of attention to that as I got older, in residency, one of my spine attendings recommended that I draw the anatomy to help better familiarize myself with it. And after doing so, I kind of got back into it, and I've been able to publish some medical illustrations in spine journals and textbooks over the past few years, which has kind of been a nice addition to my research. Joining the Orthopaedic and Spine Center of the Rockies was a clear decision for me. We have other spine surgeons here in our group, and being able to collaborate with them on a professional level has been a great attraction for me here. I think part of being a good clinician is treating each of my patients as if they were my own family, which means that surgery isn't always the best option. And I think understanding that is part of being able to differentiate and treat spinal conditions appropriately. If you're struggling with an issue of the spine and would like a new consultation, contact the Orthopaedic and Spine Center of the Rockies, and I look forward to seeing you.